What is the science of emotional regulation for cancer caregivers? Caring for a loved one with cancer can be a roller coaster of emotions, from hope to fear, frustration to compassion. The science behind emotional regulation helps caregivers understand how to manage these feelings effectively. It involves strategies that help cope with stress, anxiety, and sadness, which are common during the cancer journey. When caregivers learn to regulate their emotions, they not only protect their mental health but also improve their ability to support their loved ones. Research shows that caregivers face ongoing emotional challenges like fear of the future, feeling overwhelmed by caregiving tasks, and adjusting to new roles. These feelings can lead to burnout if not managed properly. Emotional regulation techniques help caregivers stay balanced, reducing feelings of distress and preventing long-term mental health issues. For example, being able to recognize when feelings of anxiety or sadness are rising allows caregivers to take steps to calm themselves before these emotions become overwhelming. One key approach is interpersonal emotion regulation, which involves actions like offering emotional support or physical comfort to the person with cancer. This not only helps the patient feel more supported but also fosters a sense of connection that can ease both their and the caregiver's stress. At the same time, caregivers need to focus on their own emotional health by practicing techniques such as mindfulness, which encourages staying present and accepting feelings without judgment. Therapies like emotion regulation therapy are designed specifically for caregivers. This approach helps reduce negative thought patterns that can lead to depression or anxiety. It teaches skills like cognitive reframing, where caregivers learn to view stressful situations in a more balanced way, and stress management techniques that promote relaxation. Studies have shown that these therapies can significantly lower symptoms of depression and anxiety, making caregiving more manageable. Emotional intelligence, or the ability to perceive, understand, and manage emotions, plays a big role in caregiving. Caregivers with higher emotional intelligence tend to cope better and experience less stress. Factors like age, spiritual beliefs, and caregiving experience can boost emotional intelligence, helping caregivers navigate tough moments more effectively. Psychological interventions such as acceptance and commitment therapy are also helpful. They focus on accepting difficult feelings and committing to actions that align with personal values. This approach can reduce anxiety and depression, helping caregivers feel more resilient and flexible in their roles. It's important to recognize that caregivers often face unique emotional stressors related to reproductive and sexual health, especially in cases of testicular, cervical, or reproductive cancers. Concerns about fertility, body image, and intimacy can add layers of emotional complexity. Tailored psychosocial support that addresses these specific issues can help caregivers build resilience and maintain emotional well-being. Practical steps for caregivers include learning mindfulness exercises, practicing cognitive reframing, and seeking support from mental health professionals trained in caregiver needs. Building a strong social network can also provide emotional relief and reduce feelings of isolation. Remember, managing emotions is a skill that can be developed over time with patience and support. Overall, the science of emotional regulation offers valuable tools to help caregivers handle the emotional ups and downs of cancer care. By applying evidence-based strategies, caregivers can protect their mental health, provide better support, and find more balance during this challenging journey. Always consult healthcare professionals for personalized advice, as each caregiving situation is unique and requires tailored support.